Let's talk about Gandusha, which is also known as oil pulling these days. It's not just for oral health, but also for mind care. That might sound far-fetched, right? But it's not just Ayurveda. Modern research also supports this connection. So let's break it down. So oral health is far more than just brushing your teeth. Ayurveda has an elaborate system for maintaining oral health. That includes 1. Gandusha, that's oil holding. Kavala, that's swishing the herbal oils and decoctions. Then there are dhatuns, which is like neem or babool. And there's pratisarana or pralepana, which are special herbs for gum disease or inflammation. So the oral cavity is not a passive space. It contains specialized epithelial cells, nerve endings, receptors, and blood vessels, all working together to help us perceive taste, speak clearly, and process sensory input. When these pathways are inflamed, blocked, or degenerated, we don't just lose taste or speech clarity. It can also impact memory and cognition. If you take a step back and picture your favorite dish in front of you, your mouth starts watering. And once you taste it, your senses are kindled. And neurotransmitters like dopamine and serotonin, they are released thanks to the memories and emotional associations with that dish. That's not just psychological, it's neurochemical. There's certain neurotransmitters that are released in the brain. We've all experienced nostalgia, calm, happiness, or even sadness and discomfort that certain foods can evoke. This happens because there are a lot of receptors, the taste buds, they're all connected to the brain. So signals travel from the mouth to the brain, triggering memory centers and releasing mood-related neurotransmitters. Now, if this communication is disrupted because of inflammations, toxins, or nerve damage anywhere along the pathway, from the gums to the cranial nerves to the brain centers associated with it, the right neurotransmitters may not be released. This is where Ayurvedic herbs and oils play a powerful role. The mucosal lining of the mouth is rich in nerves and blood vessels, which make an excellent medium for the herbs, especially via the oil or ghee, to be absorbed and cross the blood-brain barrier. So let's see what these therapies are. First, let's talk about Gandusha. So this is holding the herbal oils, sesame oil, or coconut oil. So keep that oil in the mouth for 2 to 3 minutes and then spit it out, preferably in the trash can to avoid clogging the drains. The second is Kavala. Here we are swishing the herbal oils. It can be the same oils or herbal decoctions, especially if there's some inflammation, sensitivity of the teeth. Use the herbal decoctions, so like Triphala decoction. These two therapies not only strengthen the gums, they nourish the nerves which are connected to the brain. They remove the toxins, reduce inflammation, and they help to clear the subtle channels like the nerve pathways and the blood vessels. They support the optimum neurotransmitter release. So rule of thumb is first to reduce inflammation or swelling, then follow with herbal oils for deeper nourishment. Some people with high inflammation may initially experience tooth sensitivity with oil pulling, so adjust accordingly. Several studies have shown that oral diseases can increase the risk of dementia, including 2.4-fold increased risk for Alzheimer's disease. Genetic analysis also supports a potential causal link between poor oral health and changes in neuroimaging markers, many of which are known risk factors for stroke and dementia. Studies have found that bacteria and inflammatory molecules from the affected gums, teeth, they can travel to the brain via the blood and trigger a cascade of events contributing to dementia and increase in amyloid protein levels in the brain, which are associated with Alzheimer's. Good oral health has also been associated with better performance in learning, memory, complex attention, and executive functions. So remember, oil pulling or Gandusha is not just for gums, it's also for mind care.